Welcome to Warwick Medical School. We present the cranial nerve exam. Please keep in mind your institutions may have different guidelines, so make sure you follow them for your exam. I leave you with the Warwick Medical School cranial nerve exam. Thanks.
Hello, my name's Dr. Gill. I've been asked to do a cranial nerve examination on you today. Before we start, could we please confirm your name and date of birth?
Yes, it's Jaspreet Kaur, 8973.
Super, thank you. So in terms of doing this examination, it's going to involve looking at the nerves and muscles that control your head and neck. That's going to involve me touching your face, which I'll ask you to do with your eyes closed as well, getting you to do some movements, and also touching your face with some of the equipment, which might feel a little bit strange. Are you happy to go ahead with that?
Yes, I am.
Super. So to start off, we're going to begin with cranial nerve 1. So we're looking at your nose. Have you noticed any abnormal senses of smell recently?
No.
And any loss of sense of smell?
No.
Super. So to start off, if I could just get you to close one nostril with a finger, please. And breathe in. And relax. And swap over for me. And breathe in. Super. So we've showed you've got good patency on both nostrils. Relax for me. So I'm going to get a substance here, and I'd like you to close your eyes for me. So we're going to test your sense of smell now. So if you could close your eyes for me and put a finger over one nostril, please. And tell me when you smell something.
Yes. Coffee.
Fantastic. And we'll swap nostrils for me. And we're going to use an alternative. And just tell me what you can smell.
Orange.
Super, thank you. So no obvious issues with that. We're now going to move on to looking at the optic nerve, so cranial nerve 2. This is with your vision. Have you noticed any problems with your vision?
No.
Super. So do you wear glasses normally?
No, I don't.
Fantastic. So we're going to use a chart here, and according to this one, I need to sit 2 meters away from you. So if you put a hand over one eye for me, please. What's the lowest line you could read on the chart?
The 6th.
Super, please do so.
LTFPH.
Super, fantastic. And you've read from right to left. If you could swap eyes for me. And what's the lowest line you could read again?
The 6th.
To confirm, if you could read now from left to right.
HPFTL.
Fantastic. So you've confirmed there's no problems there with that. We're going to have a look at your colour vision now. So I'm going to get the Ishihara charts. Have you seen these before?
No, I haven't.
Okay. So these are our plates that will allow us to look for colour blindness. So if you could tell me what numbers you see as we go through. So what do you see there?
12, 8, 29, 5, 3, 15, 74, 6, 45, 5, 7, 16, 73, nothing, nothing, 26, 42, 2 snakes, nothing, nothing, 2 snakes, 1 snake, 1 snake, 1 snake.
Brilliant. So you've passed that. So you've got all of those correct. So there's no obvious issues with your colour vision. We're now going to have a look at a little bit more of your vision. I'm going to have a look for your blind spot. So I'm going to come a little bit closer. If you put a hand over one eye for me, please. And I want you to only look in my eye here. So as I do so, I'm going to bring in a hat pin from the side. Tell me when you can't see the top of the hat pin anymore.
No.
Super. Tell me when it reappears.
Yes.
Okay, and tell me when it disappears again.
No.
And when it reappears again.
Yes.
Good. So we're equal on the horizontal. We're going to try the vertical now. Tell me when it disappears.
Yes.
And tell when it reappears.
Yes.
Okay, we're going to go up. Tell when it disappears.
Yes.
And when it reappears.
Yes.
Fantastic. So your blind spot is equal to mine, suggesting we've got no issues with that. And we'll swap eyes. We'll do the other side for me. Okay, so coming in from the side, tell me when it disappears.
Yes.
Okay, tell me when it reappears.
Yes.
Okay, brilliant. We'll go back the other way. Tell me when it disappears.
Yes.
Okay, and reappears.
Yes.
Super. So we'll go back to the up and we'll go to the vertical. Tell me when it disappears.
Yes.
Okay, and reappears.
Yes.
Okay, we're going up again. Tell me when it disappears.
Yes.
And reappears.
Yes.
Super. So it maps the same as myself. we're going to check one more thing. So I want you to look, staying with that one eye, look directly at the hat pin, and you can see it being nice and red. Okay, now swap eyes for me. Okay, and again looking directly at the hat pin. Does that look the same level of redness, or is it look less red in this eye?
Yes, the same.
Okay, that's brilliant. So you can relax down for me. So we've got no issues with that. We're now going to have a look at your visual fields. So again, making sure how far away I am. So put a hand over one eye for me. Okay, I'm going to do the same. And tell me when you see my finger waggling.
Yes. Yes. Yes.
Super.
Yes. Yes. Yes.
Fantastic. So you saw at the same point as I did. So if you could swap eyes for me. We'll do the same again. Only looking over here. Tell me when you see my finger waggling.
Yes. 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 Yes.
Super. That's fine. So we've got normal visual acuity. You can relax for me. Okay, so I'm just going to shine a light in your eye. So I'm going to put a hand over one side. I want you to look directly towards me. I'm looking at what happens when I shine the light. Excellent. And then the opposite side. Fantastic. I'm going to do the same again, but now I'm shining in the opposite eye to the one I'm looking at. Fantastic. So your pupils responded equally to the light on both sides, and when I shone in the opposite eye, both eyes contracted as well. The next thing I'm going to ask you to do is look at my finger, and then look at the mark on the wall behind me, and then back to my finger. Fantastic. All of that looked great. So what we need to do now, I need to have a look at the back of your eye. This can be a little bit uncomfortable, just because we're shining the light in your eye. So I'm going to focus the ophthalmoscope on my finger. Now I'm just going to pull the lights down. Bear with me for a second, please. Okay. I'm just going to look directly at your eyes. Okay, so I've got a good red light reflex on both sides. So I'm just going to put my hand across the centre and coming in from one side. Super. And we're going to do the same again to the opposite side. Excellent, and we've got a nice reflex on both sides. So I'm going to do once more and have a look at the opposite side, what the effect is. Good. And then again, swap over. Let's move that out just a bit more. Let's try if I do it there. So coming in from one side, fantastic. And then just looking at the opposite eye, brilliant. Then on the opposite side, nice reflex. And on the opposite, great. So we're going to have a close look in your eyes now. So if you keep looking forwards, I'm going to put my hand on your forehead so I don't bang into it. I'm just going to have a look at the back of your eye. Okay. So if you could look directly to the left for me, and to the right, and up, and down. Okay, look directly into the light, please. Fantastic. And we're going to do the same on the opposite side. Look to the left for me, and the right. Okay, look to up, and look down. Okay, and straight into the light, please. Fantastic, so everything looks completely normal there. So I could see good blood vessels to your eyes, and the optic disc looked very healthy, so we've got no obvious issues there. So far we haven't found any abnormalities with your eyes, which is fantastic. The next thing I'm going to do is I'm going to actually have a look how your eyes move. But to start off, I just want to shine a light in them from a little bit further back. So I'm just looking at where the dot appears in both eyes. And if you could just keep looking at the light, if you could put a hand over one eye, please. Okay, and then swap eyes. Fantastic. So the light stays, you relax for me, so the light stays in the same place throughout. So before we continue on, do you wear glasses at all?
No, I don't.
Do you wear contact lenses?
No.
Fantastic. So we're going to have a look at the movement of your eyes. So if you could keep your head still for me, and I'm going to ask you to follow my finger, and I'm stopping when the edge of the sclera disappears. Any double vision there?
No.
And again, the lateral edge of the sclera has disappeared. Any double vision?
No.
And going down. Any double vision?
No.
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 Fantastic. So throughout that, I've seen your eyes moving together, they've moved smoothly, and you haven't had any visual problems whilst we've done it. So that's fantastic. So what we're going to do now is I'm going to look at some of the muscles and nerves with regard to your face specifically. So first off, we're going to look at the sensation. So I'm going to check your corneal reflex if I can, finishing off your eyes. So I'm going to get this cotton wool and just touch it against your eyelid. It will cause you to blink, but it shouldn't cause you any significant problems. Are you happy to proceed with that?
Yes, I am.
So if you could keep your head still and look all the way to this side for me. Coming in from the side. Touch. Fantastic. And if you look all the way to the left for me. Coming in from the side with a fresh bit of cotton. Fantastic. So we've got a good reflex on both sides. I'm now going to do a check similar on your face. We're going to do it with two devices. So I've got the neurotip. So I'm just going to touch the top of your chest with this so you can feel what it feels like. So can you feel that?
Yes.
Superb. So if you can close your eyes for me and say yes when you feel me touch you.
Yes. 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 Yes.
Fantastic. So everything was fine with that. If you could please open your eyes. And we're going to do the same again with cotton wool. Again, I'm going to touch your chest if you don't mind. So you can feel that?
Yes.
Super. I'm going to do the same again. If you close your eyes, please say yes when you feel me touch you.
Yes. 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 Yes.
Fantastic. So that's all normal there. Now we're going to do a few movements. So if I can get you to bite down for me and relax, and bite down again and relax, and just move your jaw side to side. Fantastic. So all those muscles controlled by cranial nerve 5 are intact. The last thing for cranial nerve 5 is I'm going to try and tap your jaw with a tendon hammer. It won't hurt you, I assure you, but it is a little bit of a challenging examination because I need you to try and just open your mouth slightly and relax your jaw. Okay. Excellent. So there was no reflex, your jaw didn't tap closed, we've got no problems with that. Now, a little bit more movement from your face if we can. So if you could raise your eyebrows up as high as you can. That's excellent. We've got symmetry on both sides. And screw your eyes as tight as you can. I'm going to try and open your eyes now. Please don't let me. Fantastic. And you can open your eyes. If you could show me your teeth. Okay. And relax. And then blow your cheeks out. Fantastic. Relax for me. So all of those muscles with regard to your face are perfectly intact and you're able to perform all the actions. Thank you. So I'm going to come close to you and I'm going to make a noise to one ear and I'm going to ask you to close your eyes and I'm going to whisper a number and I want you to tell me what that is. So if you close your eyes, please. 49.
49.
Fantastic. We're going to do the same on the opposite side. Close your eyes. 66.
66.
Fantastic. So we can clearly see that your ears are hearing me well, but now we need to look at the specifics. So I'm going to get this tuning fork, I'm going to strike it, and I'm going to place it in the center of your forehead. When I do that, you're going to hear a ringing inside your head. I need to know, do you hear the ringing closest to the middle, or one ear, or the other? Okay? So where do you hear the ringing?
Middle.
Excellent. So from that, it's likely we don't have any significant issues with the ears. However, we're going to go on to just double check that. And I'm going to do the same again behind you. So I'll strike the tuning fork and I'll put it on the back of your skull. When you do so, you'll hear the ringing noise. I need to know when it stops, and then I'll bring the tuning fork around to the side to see if you can hear it again. Okay? So you can hear the noise?
Yes.
Can you hear it now?
Yes.
Excellent. We'll do the same again. You can hear the noise?
Yes.
Tell me when it stops.
Stopped.
Can you hear it now?
Yes.
Fantastic. So we've confirmed that there's no obvious issues with your hearing from a cranial nerve perspective. That's fantastic. Now we're going to go and have a look with regard to the cranial nerves 9 and 10. So that's largely to do with your voice and swallowing. So to start off, I'm going to shine a light in the back of your mouth. And if you could open your mouth and say "ah" for me. And stop. Super. So uvula and hard palate both move up equally. I'd like you to try and say the word baby hippopotamus, please.
Baby hippopotamus. Baby hippopotamus.
Brilliant. So it did take 3 goes, but that's shown that the labial control is good. And if you could say yellow lorry, please.
Yellow lorry.
Excellent. So we know that we've got good lingular control. So that all seems fine so far. Now just going to check the vagus nerve, so that controls your swallowing. And if you could just take the water for me and swallow. And any problems when you do that?
No.
Fantastic. When you do eat and drink, do you ever notice you cough afterwards?
No, I don't.
Fantastic, which suggests there's no issues with cranial nerve 10. So we're going to have a look at the accessory muscles. That's cranial nerve 11. So I'm going to come a bit closer. I'm going to put my hands on your shoulders. Please shrug your shoulders upwards, and I'm going to stop you. Fantastic. I'm going to put my hand on the side of your head, and I'd like you to turn and push your head into my hand. So push, 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 push. Brilliant. And again, the other side. Push, 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 push. Fantastic. The final thing I need to do is have a look at your tongue. So if you could put your tongue out for me. Okay, excellent. I can't see any abnormal movements. And if you could push your tongue to the side of your mouth, I'm just going to press on that. Superb. And on the opposite side. Excellent. Now relax for me. So we haven't found any abnormalities with your cranial nerves. Do you have any questions for myself before we complete the exam?
No, I don't.
Super. Thank you so much for your time today.
Thank you.